The Biden administration has just joined the growing number of credible voices calling for a full investigation into whether the coronavirus pandemic was, in fact, the result of human error at a lab in Wuhan, China. In a rather remarkable statement today on the origins of the virus, the president said the U.S. intelligence community has, quote, coalesced around two likely scenarios, but has not reached a definitive conclusion on whether it emerged from human contact with an infected animal or from a laboratory accident. Biden also added he wants another report in 90 days on that question. Now, where the coronavirus came from is one of many things that really should be investigated about the pandemic, the response to it, like why was the testing botched by the CDC so early? Why was the mask guidance so bad in the beginning and so confusing? Why did it keep changing? Why did the CDC keep clinging on to the idea the virus was transmitted primarily by direct contact from surfaces or large droplets instead of airborne spread? Why didn't they change their position on that until this month? Some of those questions will hopefully be answered by the investigation currently underway in the House Select Subcommittee on the coronavirus crisis. But there were a lot of mistakes that were made up and down our government across the board. Most of them, the most serious ones, the most cruel and sadistic and reckless ones were by Donald Trump and his administration, but not limited to that. So I, for one, want a full audit. Dr. Ashish Jha is Dean of Brown University's School of Public Health, and Zerlina Maxwell is host of her own news program, Zerlina on Peacock, and they both join me now. Dr. Jha, let me start with you just on this sort of question of getting our arms around what's happened, because I do worry. I can feel the pull of memory holing this whole thing. I can feel it myself. Like, I get why no one talked about the flu after 1918. Let's pretend that never happened. I get that. But that would be incredibly dangerous. And Donald Trump was so singularly horrible and acted in such a malevolent fashion, he blocked out other things that happened that we should also get to the bottom to. And I think that there's a lot of accounting to be done. What do you think?
Yeah, absolutely, Chris. So first of all, thanks for having me back. I think there are two key issues here that you highlight. One is anytime you've gone through a horrible trauma like our country has, the last thing you want to do is think about it some more. Yeah. You want to put it behind you. And that's fine. You get that notion. But as a nation, we cannot put this behind us. We have to learn. And the second is we're tempted to blame Donald Trump. And let's be very honest and clear. The Trump administration really, really botched this. But our federal agencies failed. The federal state structure failed. A lot of things went wrong. We've got to fix those things. We're still seeing the remnants of that even under the Biden administration. We've got to get a 9/11-like commission to do a deep dive into this and really understand all the things that went wrong and what we need to fix.
Yeah, that thing you just said, which connects to this fight we're having early over the January 6th commission. I keep thinking, like, we should. I don't know if the commission's the right vehicle, but there needs to be some real full audit of this as well.
Yeah, right, absolutely.
Because,
until then.
Sorry, go ahead. Sorry.
You go ahead, Zerlina.
No, because this is a once-in-a-generation pandemic. And so you're in a moment where you have Donald Trump politicizing and essentially corrupting the information flow of scientific information from the beginning. And now you're in a place where essentially opening the door to saying maybe the Wuhan theory with some caveats has merit or at least should be seriously looked at. And you don't want to seem like you're aligning yourself with Donald Trump, who nicknamed this virus something racist. And so I think, he conflated sort of the bioweapon theory with the lab accident theory, if you will. And I think at the end of the day, people just didn't want to seem aligned with the man who told everybody on TV to inject bleach.
Yeah, and I think when you say infect, I mean, in some ways, the information stream was so polluted from the beginning that it was very, very difficult to make judgment. I mean, hydroxychloroquine is a great example. It's like, I don't know, maybe the malaria drug works. I'm not running any clinical trials. Like, I hope it does. But everything that is being channeled through this font of disinformation is going to corrupt our ability to form judgments on it, Dr. Jha.
Yeah, absolutely. And that's the hardest part of our job in front of us, is to look through that fog and look at what is right and not. There are things the Trump administration got right. For instance, I think they got a lot of Operation Warp Speed in building the vaccines right. The problem is if we look at this in an excessively kind of political way, we're going to be stuck. And what we want to do is really understand what went right, what went wrong, and then move forward, building a federal system that can respond to future pandemics like this.
The other aspect of this that, among many, Zerlina, that I think merits real focus and has been throughout coverage is just the disparities in who got hurt by this, and particularly racial disparities. We're seeing those play out now, even as we get into vaccination. This is a chart showing black residents in D.C. are now accounting for more than 80% of COVID cases in the district. And you can see that divergence happening there. And that's a divergence born of divergent vaccination, which just reinscribes the divergences we saw in earlier parts of the pandemic.
Yes, Chris, and one of the things that I think is so important to understand is that those comorbidities that, doctors like Dr. Jha were laying out as this virus was coming to the United States and everybody was sort of trying to wrap their heads around what it meant for them, the existence of those comorbidities is the result of the same systemic issues that we talk about in other contexts. So poverty, lack of education, lack of health care, lack of access to healthy food. If you live in a food desert, your heart is likely not going to be quite as healthy as somebody who has access to organic fruit and vegetables every single day. And so I just think that it's important for us to look at those systems very closely, because that's a piece of it too. Even with the vaccine, which is a miracle of science, by the way, you can't get the shots in the arms unless you have all of the pieces together, and you want to make sure that everybody has that correct scientific information from the beginning, so that by the time you get to the vaccine, it's not too hard to convince them to take it.
And finally, and quickly here, there's things we did wrong and things we've done right? So on the vaccine front, it is a miracle, to Zerlina's point. I love this headline out of Ohio when, Mike DeWine had the lottery, and I was kind of like, look at that. And then the numbers say that boosted 45%. There's good lessons to draw here too, Dr. Jha.
Absolutely. And at this point, we just need to get people vaccinated. We got to get information to them. We got to make it easier. And if it's lotteries and beer and donuts, I'm all in. Whatever is going to get Americans vaccinated, that's what we need to be doing right now.
Yeah, I saw some stats today that the new MTA subway program in New York City's got 11,000 shots in arms, which, again, go to where people are. Dr. Ashish Jha, Zerlina Maxwell, thank you for making time tonight.